formula feeding, I'll get more sleep. No, that's not true. This, that, or the other. But yeah, if somebody has an idea in their head that might not be right, we could correct it. And if they have, maybe some self-doubt or, things like that, I think a lot of times it is, yes, you can. It can be very scary, and it can be very, it's a whole new experience.
When women have, questions about night feeding and breastfeeding at night, a lot of the times all they need to hear is, I get it. I remember feeling so exhausted and looking at the clock at 12:15 and 1:30 and 3:15.
And that's the first tip.
Yes.
Never look at the
Absolutely.
clock. Turn the clock around. I mean, if you have to have an alarm, have the alarm on, but then turn it around because
cover it up.
It's the worst thing to look at it and know, I was just doing this half an hour ago and I'm doing it again and I have to get up in another 2 hours,
So sleeping is a topic that's very, very common now, but we know that it is normal for infants to wake up through the night. It's actually a protective factor, and that sleeping through the night is only 4 to 5 hours stretch, and our society has a concept that it's much, much longer. Parenting happens 24/7, and our babies' needs need to be met no matter what time of the day it is.
But I think also what I see on a regular basis that is a very common challenge is people go, is my baby getting enough? How would I know my baby's getting enough, right? My baby's waking up so much at night, and I don't know if I have a good baby. I always go, what is a good baby, right? When we say someone sleeps like a baby, I always chuckle a little bit because I'm like, oh, so they're up every hour and they need to eat, right? It's not that they're having this super great sleep.
You're somebody who knows what it's like, and it means a lot to be helped by somebody who can say, oh yeah, I've been... if my baby's nursing 30 times a day, which some of them do, or even 15 times a day, they think something must be wrong with my milk. And so they'll try different things that they think will help. They'll think, well, I'll stretch out the time between the feedings a bit, and then my breast will fill up, and then the baby will get more milk. But in fact, it works exactly the opposite. It comes from us not really understanding how breastfeeding works.
Yes.
And so what we know is that the more frequently you feed the baby, the more empty your breasts are most of the time, the more milk you'll make. When you let your breasts fill up, when you go a longer time, the methods your breasts get are make less milk, make less milk. And so maybe she didn't really have a low milk supply in the beginning, but she creates one by what she's doing to solve it.
It was very important for me getting started because, like many new moms, I reeled from the pain that I wasn't expecting when I first established those first latches. They weren't really correct, and that's why I did experience some pain.
I hear breastfeeding is so hard. I feel this is going to be so difficult. Or somebody's told me I need to roughen up my nipples to get them ready for breastfeeding, right? And so I think those already create challenges. They already create barriers before someone's even tried to breastfeed.
Regardless of what anybody says to you, if you don't feel good about it and you don't feel that it's a good latch or it's hurting, then you're the expert, not someone else. Regardless of what your latch looks like, get help.
Well, systematically in the industrial countries for the last 40, 50 years, there have been a miseducation or subverting the knowledge about breastfeeding by the competition, by the formula industry.
Yes.
Well documented all over the industrial world. I just finished teaching an elective for first-year medical students at my university, and they knew nothing. Some of them had never seen a breastfed baby, and they're in their 20s.
And if you haven't seen a lot of babies, sometimes it's hard to even imagine it. It's hard to, what is your life with a baby going to be like? And what we've seen is the soap operas, right?
That's right.
Where the baby cries, somebody takes it, it naps apparently for 3 episodes, and then it comes up again, and so that's kind of what we're expecting, and that's not quite what it's like.
I think every month that I did it, I thought, let's do it for one more and see how this goes. And when I started introducing solids around 8 months, I think I had assumed that you stopped nursing, but through the communities of other moms, as well as my, of course, friends and family, I was encouraged to just continue.
I understand that a lot of women face challenges with breastfeeding in generations past. They were given a lot of bad information. They weren't provided with a lot of support. And I think nowadays when we have this information, we can really be strong in knowing that most women can produce breast milk, and it's a very low percentage of people that can't with the right support.
I think one of the really important components to our program and the hospital's collaboration is that they are getting that consistent information, and that makes a huge difference.
And getting it early too. We're really talking when patients come into triage or they go online to register. We really encourage them to check out early breastfeeding supports, especially the Me Breastfeed workshop.
Yes.
We really encourage that because we know to get the information before you have the baby, and I find a lot of people don't find out what breastfeeding is all about.
Yeah, it's true.
They think it's just a process that occurs naturally, which it can.
Yep.
But sometimes people need a little extra help, and we want to make sure that people know what to do before, rather than being in more of a crisis situation when they have the baby there in front of them.
So when the milk comes in, we know that this is hormonally driven. We know that whether you decide to breastfeed or not, your milk's going to come in. And we still haven't figured out a better way to describe that except the milk coming in, because it's always been in. It's just that it comes in more volume, right? So that usually happens 30, 40 hours after delivery, different for every situation. How can you make the milk come in as quickly as possible, do you think? Frequent feeds, skin to skin, early, often, effective feeding gives you enough milk to be exclusive. You can't put exclusive on the top if you don't do early and often and effective.
When you ask a pregnant woman what, are you getting as gifts at your baby showers, almost every one of them wants to breastfeed, says they're going to breastfeed, but they all have pumps.
It's fear, I think. The fear of not making enough, the fear that your baby won't latch. We all hear the horror stories of babies. Lots of babies don't latch right away. Lots of women don't make tons of milk right away. But we almost default to our mechanisms, our equipment to keep us out of trouble, when in fact, how easy is it to fall in love with a pump? It's not always easy to respond in a physiological way to a piece of machinery. A lot of women find pumps a saving grace, but many women are completely turned off by a pump and they just don't respond to it. So does that mean you're not making milk? Not at all. It just means your body's too clever to release the milk for a machine.
That's right.
But if you do teach hand expression, you normalize everything. Knowing your breasts, knowing what the changes are, knowing they're going to make milk because you've been massaging them, there's milk in there. By the time you have your baby, you're ready to roll, and you're familiar with handling your breasts, so you're not feeling uncomfortable about putting the baby on. This is where hand expression builds confidence. Yes, if you can get a few drops of breast milk out by hand, you feel confident. If you put a breast pump on in that first 24, 48 hours, nothing's going to come out. So now you've validated all your fears of not making enough.
It's almost as fast as the pump, and it's very consistent. Anytime I hand express, milk comes out and I can collect it for later use. And that kind of wiped out that doubt, about her getting enough milk or not when she latches on.
Human milk is a live fluid, so it contains antibodies, for example, to anything the mother's exposed to. So if you go out with your baby and there's some, staph germ around, whatever kind of germ is there, and you pick it up, you right away start producing, you're an adult, you have a mature immune system, you start producing antibodies to that. It goes into your milk and your baby gets it right away. Before that germ has a chance to get going really in your baby's body, and he's protected against that. And so your milk is changing all the time because you're always out being exposed to new germs, besides the ones that the baby gets at birth from your milk, from the colostrum, which is really high in antibodies. So it's kind of an amazing process. I heard one speaker say that breastfeeding is actually an immune support system cleverly disguised as a method of feeding, because we think of it as feeding, and we forget all the really huge things it's doing in immunity and protecting the baby against disease.
It's a generation of being perfect all the time.
Yeah.
And sometimes people's goals are a little skewed, It's just about, the first 6 weeks are so crucial.
They are.
And it doesn't matter if you don't fit into your certain yoga pants, whatever, just be with the baby. We call it the baby moon. Just for your partner and yourself and the baby, just to really... But it's hard for mums. They're getting a lot of information off everybody.
Yep.
and it's who do I listen to?
Yeah.
And it's having that trust in the community resources, and that's where I'm going to get my information from.
The other stuff that's going on with babies that affects sleep is they are trying to triple their weight in their first year. So you can imagine how much would you have to eat if you wanted to triple your weight in a year, and how often would you have to eat? So you're going to have to get up in the night in order to eat, and a baby has a tiny stomach. So those night feedings are not just for fun or because the baby has gotten into a bad habit. There's something the baby needs to do in order to grow normally.
It comes from a climate of the last 40, 50 years where breastfeeding was not valued, and a lot of it was because of undermining, because of formula marketing. Yeah, and it's still going on, and it's still worse. And I'm reminded of the Star Wars character Yoda, who says, there is no try, young Skywalker, it's do or not do.
Right.
Yeah, the milk's gonna come in, what are you gonna do with it? You can throw it away or give it to your baby.
But I think sometimes people think they've done something wrong. They're not feeding their baby well because they don't always have great information of what is really newborn, normal newborn behavior and what to expect from themselves, and bringing some of the expectations of having a perfect house and a meal ready and some of those things down a little bit, especially in those first weeks and months, to really get to know that baby and create a really great support.
So many Canadian women feel that they don't have enough milk supply, and I think this is because they're not maybe educated on how small the baby's tummy is. It's only the size of a cherry and develops to the size of an apricot as the days goes on. Babies really only need drops of colostrum the first early days, and then that slowly builds up with time. I think if women know and understand how their bodies work and how little their tummies are, then they can stick it through and continue to breastfeed their babies if they have that education. The risks of formula feeding involve many diseases to children, including lung and ear infection. Contaminated formula can cause many infections. It can cause chronic disease, including diabetes, asthma, heart disease, obesity, childhood cancers, bowel diseases such as IBS, Crohn's, and celiac, and also increases their chances of having allergies to many foods.
Myths are a funny thing, and they're almost always never based on evidence or research or truth. Your body is perfect the way it is, and it'll be able to nourish your baby. Be confident.